Hey there guys, my name is Morgan Goen. I'm with Jeff State's PTA program, and today I just want to tell you a little bit about a patient that I got to work with. He was a 48-year-old male who is an engineer, and he liked to play tennis a lot. Now about 2 weeks ago, he was playing a 4-day tennis tournament, and during that 4-day period he accumulated a lot of pain and soreness in his right forearm. Well, this patient decided to play through that pain, and now he is currently diagnosed with right acute tennis elbow by his MD. And this patient is now in physical therapy for treatment. He currently takes oxyprozine, also known as Daypro, which is a non-steroidal anti-inflammatory drug used to relieve a lot of swelling and stiffness seen in patients with joint pain and rheumatoid arthritis. Now, tennis elbow is a name given for lateral epicondylitis because it was seen in a lot of patients that played tennis for extended periods of time, but it is actually seen in a lot more of workplace injuries with people that do a lot of construction work or work on an assembly line or even sit on a computer and type or write for extended periods of time. Now, this injury is caused by a lot of extension of the wrist and fingers. The muscles that attach to the lateral epicondyle rub up against it and can cause a lot of friction, which will cause swelling and inflammation. And in severe cases, it will cause the tendons and muscles to tear, and this can increase the recovery time. Now, some things we wanted to watch for with this patient from treatment to treatment was subjective, his pain scale, and the activities that he did that caused more irritation and his symptoms to increase. Now, some objective findings that we needed to reassess each treatment were the patient's strength and his range of motion being passive and active range of motion. Now here's an animation to better explain the anatomy and physiology of tennis elbow. So take a look.
Movement is accomplished by an interaction of the bones with muscles, ligaments, and tendons. However, sudden injuries or repeated physical stress can damage the tendons that attach muscles to the bones. For example, one common injury affects a tendon that anchors the extensor carpi radialis muscles of the lower arm to the outside bump or epicondyle of the elbow. Because this muscle is used to pull the hand backwards, as in a backhanded tennis swing, the injury is often called tennis elbow. The repetitive movements required during tennis, as well as with painting and many other tasks, put stress on this tendon and causes small tears. Inflammation or tendinitis can then develop and will be accompanied by soreness or pain on the outside of the upper arm near the elbow. Treatment of tennis elbow often involves rest and immobilization of the arm. A brace may also be beneficial, primarily because it prohibits use of the elbow.
I wanted to educate this patient on some techniques they could do to help decrease their symptoms when they return to playing tennis and when performing daily activities. First, I wanted to inform the patient on the use of a two-handed backhand while playing tennis. This will help them put less stress on their wrist extensors, therefore reducing their symptoms. The next adjustment I suggested was to increase the grip to a moderate size so the wrist did not have to extend as much but was already in an extended position. This also will put less stress on the wrist extensors while playing tennis. Lastly, I advised that my patient get a tennis elbow strap. Now with this, you will place the strap below the elbow and wear it during strenuous activities. The science behind this is that the strap actually changes the origin of the muscle by applying pressure below the lateral epicondyle and keeping the tendons from rubbing across it. With these modifications, this patient can still do all the activities they were doing prior to their injury with little to no reoccurrence of symptoms. For treatment of this patient's tennis elbow, I decided to use some gentle cross-friction massage on the tendons to help realign the collagen fibers and prevent any fibrous adhesions. Our patient presented with pain during range of motion, and this is going to help the patient have better mobility and function of the wrist and hand. Alright, now I'm going to show you a little bit of cross-friction massage on my lovely patient. Cameron here. Wave hi, Cameron. Alright, and she's studying for nursing right now, so we're not going to bother her, and we're just going to use her arm. Okay. Well, first you want to make sure that there's no oil or any lotion on the skin to prevent you getting a good friction massage out of it. And you want to make sure that you go perpendicular to the fibers. So what you want to do is make sure their arm's at a good position, supinate the hand, And then we're going to go feel for the lateral epicondyle. You go about 2 fingers down from that, and we're going to rub slowly and with pressure. Like I said before, this is just going to help realign those collagen fibers and help there not be any adhesions in the tendons. Now we're going to do this for about 5 to 6 minutes, and then we're going to take a break because it's not the most comfortable thing in the world, but we'll give a break at about 5 and 6 minutes, and then we'll start again and do this about 3 times. So that's cross-friction massage. Thank you. A home exercise that our patient will learn is a way to stretch the wrist extensors. Our patient had pain with wrist extension, and this exercise, if done correctly and sufficiently, will increase the range of motion and help decrease the pain associated with wrist extension. Alright, now I'm going to show you a stretch for the wrist extensors that the patient can do at home that's going to help them with their range of motion and help it be a little bit less painful when they're going to that wrist extension position. Alright, so I'm going to use Cameron as my patient here, and she's going to demonstrate understanding when we get done. So what we're going to do, we're going to make sure we keep a nice straight back, keep the arm fully extended, take the other hand, reach on the back of the hand, and pull in. We're going to hold that about 20 seconds. We're going to do it 5 times and 3 times a day. If you feel any pain or any discomfort doing this, stop and make sure that you let someone know your MT or your MD, okay? Okay. Alright, thank you very much. And that's how we do a stretch for the wrist extensors. The prognosis for this patient is looking good. After a 4-week treatment period, the patient is able to go through all active range of motion and passive range of motion without any pain. Also, strength has increased in the right elbow from 75 pounds with increasing symptoms to 95 pounds without increased symptoms. The patient is also able to tolerate deeper palpation than before. I believe that they will without a doubt be able to return to work and playing tennis in the next 3 weeks. I do, however, suggest that the patient use a tennis elbow strap to prevent any reoccurrence of symptoms and rest the arm if it does become sore. In the next treatment, I would progress to further strengthening of the wrist extensors and finger extensors. With time and dedication, this patient will be returning to full prior function in no time. Thank you for listening.